Hello, everybody. So, this is going to be the NUR 4590 BSN Leadership Exam 1 review. And I'm just mainly doing this because I feel like our teachers don't give us enough guidance at the moment. So, I'm going to go ahead and share my screen. And we're going to go ahead and get started. Alrighty. So, I believe this exam is going to be on modules 1, 2, and 3. So, chapters, I believe, 1, 6, 4, 2, 3, and 15. So we're going to go ahead and jump right in. So first thing we need to know is what is exactly leadership and management and what's similar or different. So leadership is the process of influencing people to accomplish goals, and it's based on behaviors rather than task oriented. So it's about influencing people and your relationships. Think about it as you're a nursing student at the moment in your clinical groups. How are you going to influence change, and how are you going to get people to understand your ideas? And these ones really innovate and conquer the situation, while management is basically task oriented of coordination of resources through different goals and objectives. They work with different groups to accomplish organizational goals. Think about your manager at your local business. They're at your job. They're the ones figuring out what works and what doesn't. They're doing a lot of more tasks rather than being a leader. But you can be both at the same time, which is really good. So basically, a leader is one that must have good interpersonal relationship skills. They have to have good skills for the problem solving process. They have to think critically, and they use the diagnosing, adapting, and communicating aspects, which they have to understand the situation, adopt behaviors and resources to match the situation, and advance the process to where people can understand and interact. Now we look at emotional intelligence, and it's basically based on traits: self awareness, self regulation, social awareness, and relationship management. And self awareness is you have to know yourself, your mood. You have to be able to take action and to not transfer negativity onto the staff. You have to be empathetic and express emotions about others. And you have to be effective with your communication and to be mature around other people, which includes your patients, families, yourself, and your colleagues, which is really important to understand as a leader. So a formal and informal leader. So formal is one that's given a title. For example, you are going to be a charge nurse. That's your job description. Or you're going to be, the unit educator or the clinical nurse specialist. Or you're going to be the nurse manager. So that's the formal title. The informal is going to be the person that doesn't have that authority, but can influence peers and others. For example, there's just a regular staff nurse that leads a shared governance committee. That's probably going to be an informal leader because that person is just a regular staffing nurse, but they want to influence how people react to change. It's an informal position, but it's not like they're able to still lead. So this is based on 5 aspects of leadership. So the leader must be strong, have basic behaviors and the ability to influence others through the self, and to always have self-awareness, energy, confidence, motivation, and social awareness and skills. The follower is one that must accept or reject the leader and determine the leader's power, which can be developed over time. A followers must be assertive, determined, and willing to challenge ideas and be open to new ones, which can be creativity, and also have self-awareness. There's different types. There's a situation, which is there's specific circumstances surrounding a leadership situation based on work, task, interactions, decision making in the environment. This could be basically like on a unit, you're in a committee, you're trying to make long-term, short-term change. Communication can vary among groups, but it can be verbal, nonverbal. It can be up and down, horizontal, networks, formal and informal. So basically, a downward structure would be a nurse manager is proposing a thing and is communicating with all their employees. Upward structure would be a staff nurse brings a concern to the manager. Horizontal would be different nurses transversing with others or with other providers like therapy, nutrition, pharmacy, etc. Formal and informal, can be on the phone, can be in a meeting, whatever. Goals is basically what you're working towards. It could be congruent or in conflict. So, but you should probably know that. So trust impacts leadership, and it helps to bring leaders and followers together. Behaviors, you have to have trust in each other to be able to lead, and you have to be able to strengthen that environment. So difference between task-based and relational-based leadership. So task-based leadership is to where the extent to which a leader is going to organize, define roles, and explain activities. And relationship-based is basically based on like personal behaviors and communication. So think about task as like organization. Relationship-based is like your feelings. So this next section you need to pay very close attention to because this is probably going to be on probably 100% on the test. So authoritarian, democratic, and laissez-faire leadership styles. You have to know this. So the authoritarian is basically that direct leader. Basically, the policy is going to be made solely by them, and they're going to be basically like that dictator. And they're going to tell followers what to do and how to do it. And the problem is that it can be hostile and can create dependency. However, it's going to be good for like a code situation. So basically, the person who's a leader in a code situation is going to usually be authoritarian. They're going to give out orders. They're going to tell this person to do this, that person to do that. Democratic. So think about democracy, how our government is, and how we all have to like voice change, and it's based on more surrounding people. So it's based on relationships, and it's person and group oriented. Human relations are focused, and it's basically like a shared decision making. But the problem is it can take longer because you have to get that time needed for group consensus, and it's hard to get people focused on the problem. However, this is going to be very good for nursing when you're having multidisciplinary team patient care meetings, etc., because everybody has to make a decision for the benefit of the patient. Laissez-faire is basically like the lazy leader, where they promote complete freedom for groups and individual decisions. There's minimal leader participation. They really just kind of like don't really have like a say in it. They kind of like let the followers and the other people do what they want to do. But it's good for like if you're in like a private practice and you just kind of have to like kind of do it yourself kind of thing. Here's some other leadership characteristics. So the bureaucratic are just basically very strict in hierarchy. Charismatic is they have like a good presence to them and they motivate teams to follow their lead. It's good for like a high energy workplace. The servant is one that is sharing power and puts others first. The situational is based on kind of like the assessment of the situation and basically modifying that leadership style to meet the situational needs. Complexity is based on like scientific practices. To lead authentic is being based on one's true self and the leader is aware of how they think and act. And clinical is the one that's going to be that leader who has clinical competency. So that's going to be usually you as a staff nurse. So the feminist leadership perspective is definitely going to be on there. And it's basically a structure that's dynamic and it's based on a concern for family, community, culture, and it's based on like relationships and emotions, kind of like how females act. Six Sigma is a quality decision support technique that assists with improvement models and eliminates deficits in safety quality of healthcare. So the transactional and transformational leader is, so the transactional leader is going to be one that functions in a caregiver role. It is focused on day-to-day operations and sets goals based on the followers. And the transformational leader is one who motivates the followers to form their full potential over time and has like a sense of direction and stigma. And they're going to be the ones that empower others. Situational leadership model is going to be focused on task behavior, relationship behavior, and performance readiness. There's a grid with like a bunch of quadrants on it based on relationship, and you have to consider the amount of ability, knowledge, skill, expertise, willingness, confidence, and motivation for tasks. So effective leadership is based on the one's ability to adapt to an environment, have a strong relationship of themselves and those around them, and has a focus on goal and uses empowerments to do their best. So nursing management is different than regular management. It's because it's coordinating and integrating nursing resources with the management process to accomplish goals, while regular management is focused on the coordination resources to accomplish organizational goals. So basically, like nursing management would probably be getting nursing resources to benefit patient care or patient outcomes, while regular management is maybe to boost sales. 5 perspectives of management. We have reflective, which is the self, analytic, which is the organization, worldly is based on the context, collaborative is relationships, and action is creating that change. 4 steps of the management process is planning, organizing, directing, and controlling. So planning, you have to determine short and long-term objectives, just like how any planning would be. And you have to be detailed and go from broad to specific. And there's different types of that. So process, strategic, and tactical. Organizing, you have to mobilize your resources to accomplish the task. You have to have direction to motivate, guide, and lead people through the work processes to carry out that change in management. And controlling is monitoring and evaluating the actions and taking corrective action and change if needed for your evaluation. So now we have contingency, systems, complexity, and chaos theories. So contingency is based on the basic principle that managers have to consider the situation and all elements when making the decision. The systems theory helps managers to recognize work as being a part of the system and assists with better understanding of the system. And that changes the whole and may create a ripple effect. The complexity is based on the entire system and how each part functions over time and complex. And chaos is like an unpredictable behavior despite certain regularities. Now we move on to chapter 6. So role management, you have to define the role. Educate others, you got to select the right person to do the role. You got to give enough support, which is like your training. It's just your preceptorship. You have to master the role development, which is that time that you probably in your preceptorship, and you evaluate, which is basically like your performance, like acquiration, like your, 3-month performance appraisal with your manager. So a leader must be accountable, reflect on actions, take instruction, have inventory of strengths and weaknesses, excel in emotional intelligence, resilient, comfortable with solitude, and look at the big picture. Different strategies to achieve success. So I'm going to go into 5 rights of delegation: right task, right condition, right person, instructions and communication, and right supervision. And when you're delegating a task to somebody, you have to understand that the delegate has to be trained to do the task. The nurse can only delegate tasks that do not require nursing judgment and thinking. For example, the nurse cannot delegate tasks for teaching or for assessing. Delegation should always be done by authority and has to be in the scope of the Nurse Practice Act, and you have to have a lot of time for tasks. So 4 ethical principles, you should probably know this already. I'm going to just really name like all of them. You got autonomy, which is like self-determination. Beneficence, doing good for others. Non-maleficence is avoid causing harm. Justice, fair and equal treatment to all. Veracity, which is like telling the truth. Infidelity is keeping your promises. Now we're going to move on to Module 2. So we go back into clinical judgment, clinical reasoning, and clinical decision making. How much time do I have left? So clinical judgment involves forming, refining, and evaluating hypotheses based on external cues. And clinical reasoning is decision-making processes with professional thought processes. And clinical decision-making is clinical judgments that result in interventions at the point at patient care. For example, if you put an example, this is going to be deciding not to give a blood pressure medication if you assess a blood pressure to be 90/50. Next, we have the DECIDE model. So it assists managers with situations. These define your problem and the urgency. You have to establish your criteria to what you want to accomplish on feasible problems. Consider your alternatives. Identify best choice for the situation. Develop an action plan and evaluate your decisions. Problem-solving processes: define, gather, determine your goals, develop your solutions, basically like your nursing process. So prioritization is important for decision making is because the nurse is going to have to care for one patient at a time, and the decision is going to have to be made based off of what's most important for the patient. For example, a nurse is going to probably see an unstable patient before they see a stable patient asking for pain meds. Patient acuity is based on the rating of a complexity of a patient's situation and need severity, and the nurse intensity is going to be the degree of work that the nurse is able to do based on illness, care dispensing time needed. For example, an intubated and sedated patient is probably not going to be given to a nurse that floats from med-surg. They're probably going to be given a more stable, more awake kind of person. So we have various decision-making tools. And to this, I also want to know the decision tree in the fishbone model. So we all probably know what shared governance is. It helps with empowerment and decision-making that is based on promoting staff nurses' responsibility and accountability. And pilot projects is a carefully designed trial that's very small and restricted to see if a major problem occurs. SBAR, you should probably already know that, helps with communication at the bedside. And simulation is going to help with skills and verify competency with nurses and students to prevent errors. For example, we did a simulation of a Code Blue scenario in Simulation Lab to help us understand what could happen in a real scenario. Now we're going to have direct intervention, indirect intervention, watchful waiting, collaboration, and consultation. So direct intervention is when a manager makes a decision that can affect a client or staff member. So this could be like your disciplinary action. Indirect intervention is when the employees decide to solve the issue themselves. For example, there's maybe there's no unit secretary and employees have to figure out when is the best time to order supplies. Watchful waiting is when a manager watches certain behaviors of an employee first before intervening with action. Maybe if a nurse is going to leave the unit, they might decide to slack off. Collaboration and consultation is when the patient team decisions are made with all team members together, which is like your interdisciplinary team meetings. So lastly, we have some plan change, intervention, transformation, resistance, and change agent. So plan change is kind of like something that you know beforehand to implement change into a better one. Innovation is adaptation and creating new models and strategies to increase survival of the organization. Transformation is a complete change in the appearance or character. For example, maybe a new grad is eventually seen after a few months of being stronger at the bedside. Resistance is the refuse to be accepted by change. So maybe somebody, if they don't want to comply and get their COVID shot and it's mandatory, they might resist it and not want to get it. And it can stop the process of patient care. Change agent is one that is going to facilitate changes in behaviors. So the rapid change cycle is based on the idea that changes should be piloted on a small scale to see how they work and encourages the staff to brainstorm new ideas and test its effectiveness. This could be used with video monitoring systems It might be piloted on one unit, and then if it works, they're going to spread it to everybody else. Transforming bedside care, it's going to use to improve quality and safety by engaging with small tasks, evolving the idea, getting feedback, and making modifications until the best outcome is reached. So like your fall precautions, they might do this thing, and they might relook at it, and they do this thing, and relook at it, and do this thing. And it's going to transform based on patient care needs. So a learning organization has to be committed to keep pace with healthcare needs and demands, and each is going to be based on how like a team member think and interact. For example, at my facility, a lot of the practices that we use is based on kind of like how the team members see things and how they want to promote change, and the infrastructure has to support ongoing learning and knowledge acquisition, and it's going to help transform the behaviors that represents a new culture based on empowerment, shared decision making, direction, and shared governance. So this is going to be based on successful plan change, relative advantage, complexity, compatibility, triability, and observability. So relative advantage is the degree which change is brought to be better than the status quo, the degree at which change is compatible with values of the individuals or group. Complexity is based on if the change is going to be difficult to understand. Triability is going to be the degree to which a change can be tested out on a limited basis. And observability is if it's going to be visible to others. So this next part I'd also probably want to know about the innovators, early adopters. So innovators are going to be the people who are going to first change, and they're going to take a risk to do the change. Early adopters is going to be the people who have a lot of opinion towards the change, but they're going to be willing to change very first. The early majority is going to be those who adopt an innovation after a varying degree of time. However, it's going to be longer than the first two categories. Late majority is going to be those people who adopt the innovation after the average member of society, with high skepticism in the majority of society accepting the innovation. And laggards are going to be those to lastly adopt the intervention. And they're probably not going to have an opinion, and they might not want to take the change. So this could be applied to the COVID vaccine situation. The innovators are going to be the ones that are going to first get the shot. Then those early adopters are going to go ahead and get the shot. The early majority, once it's to the public, they're going to probably get it. Like majority of those people are going to maybe they want to get it, they don't want to get it. And the laggards are going to be the ones that are completely I'm against getting my COVID vaccine. So Lewin's change process is based on unfreezing, moving, and refreezing. So unfreezing is taking out that old knowledge and creating a need for change, and it can help with cognitive exposure. So think about it as your nursing your problem identification and diagnosis. Moving is going to be proceeding to new levels of behavior, and people may look at it from a different perspective and do a pilot test before full-on transition occurs. Refreezing is when those changes are going to be integrated and stabilized, and you might need behavioral enforcement to help with compliance to the change. So safe climate is based on shared perception of employees about safety in an organization to keep nurses safe, and nurses and patients safe, both physically and mentally. And you have to use all those characteristics. A healthy work environment is when you have one that has effective leaders at all levels, lots of opportunities for development, staffing that is considerable and considers nurse competencies, needs, and teamwork, a lot of interdisciplinary collaboration, maybe they have multidisciplinary team meetings. There's shared decision making. There's a lot of probably shared governance and teams at the facility. It's patient-centered, and there's a lot of quality improvement, and it's based on evidence-based practice. A just culture is that middle ground between patient safety and a culture that supports error reduction, and you got to have a lot of accountability, and you can discuss your mistakes with the intention to learn with it. So magnet recognition, if you don't know what a magnet hospital is, Google Johns Hopkins, Google Mayo Clinic, Google Cleveland Clinic, Google Boston Children's. This is basically what our magnet recognition is. It's the gold standard for nursing, and it's by the ANCC. It attracts nurses who are wanting to have a positive culture and have good professional outcomes, meaning they might want to get a different certification for their job. Maybe they want to go back and get their master's degree. It's basically like the highest level of recognition you can get. So that's all I would know for the exam. I would also probably go in and try and do as many practice questions as I can. So going forward, good luck on your test. I hope this was helpful in any ways. And yeah.